least 52 people have been killed in a fire at the coronavirus isolation ward of a hospital in Iraq, the second such deadly blaze in a COVID-19 unit in 3 months. The fire broke out at the Al-Hussein hospital in the southern city of Nasiriya late on Monday and was brought under control by civil defense teams. A medical source with the health directorate told AFP news agency the main reason behind the fire was the explosion of oxygen tanks. Al-Zamili, the local health authority's spokesperson, said early on Tuesday that 52 bodies had been retrieved while 22 people had been hurt after the fire had ripped through the COVID isolation ward. The victims died of burns and the search is continuing, he added, noting that there were fears people could still be trapped inside the building. The ward had 70 beds. Health sources told Reuters news agency the death toll could rise as many patients were still missing. 2 health workers were among the dead, they said. Health officials at Nasiriya said search operations at the hospital were continuing, but that thick smoke was making it difficult to enter some of the burnt-out wards. Footage shared online showed thick clouds of smoke billowing from the hospital buildings. Al Jazeera's Mahmoud Abdul-Wahid, reporting from Baghdad, said family members and city residents had rushed to the scene. Many of the victims were on respirators being treated for COVID-19 and were burned or suffocated in the resulting inferno that spread rapidly through the hospital, where dozens of relatives were visiting patients in the intensive care unit. The then health minister, Hassan al-Tamimi, resigned. Iraq has recorded more than 1.4 million coronavirus cases and more than 17,000 deaths.